Hi guys, welcome back to my channel. If you're new here, then my name is Lacey Alanna, and this channel is going to be all about my journey with autoimmune disease and also Christian lifestyle content. So please press subscribe so that you can follow along and just see what I'm up to and what in the world is going on, and maybe you'll even get some good laughs out of this. This video is going to be about my autoimmune disease treatment. In the last video, I talked all about my journey to getting diagnosed. And in today's video, I'm going to be talking all about my treatment and specifically about Plaquenil or hydroxychloroquine. That is the medication, the primary medication that I'm on to treat my autoimmune disease symptoms. And I am going to give that a full review today. So we're going to talk all about the pros, the cons, the good, the bad, the ugly about Plaquenil or hydroxychloroquine today. So Plaquenil is actually a medication that is used for malaria. It is an anti-malarial drug, and scientists and doctors found that it was also effective for autoimmune diseases because it suppresses the immune system. So that is why Plaquenil is so effective for lupus patients and patients with other autoimmune diseases. So I wanted to make this video to describe the journey since my diagnosis, to review the medications that I am on, for those who are thinking about what treatment course that they want to take, and to talk about my personal experience with the medications that I'm taking. I also must give the disclaimer that I am not a medical professional, and so you should definitely talk to your doctor before starting any medications, and talk to your doctor about what they think is the best course of treatment for you. So right now, for my mixed connective tissue disease or undifferentiated connective tissue disease, I am taking mainly 3 medications. Number 1 is the Plaquenil or hydroxychloroquine. Number 2 is Sulfasalazine. And number 3 is Prednisone, also known as corticosteroids. So, as I talked about in my last video, my primary symptom of undifferentiated connective tissue disease was severe joint pain. It was causing me to not be able to do many things, to not be able to do chores around the house, to not be able to work at 100%. Secondarily, some of my symptoms were sore throat, losing hair or bald spots, chest pressure. So those were really my primary symptoms that the doctor wanted to use medication to decrease or eliminate. So once I got to build a relationship with my rheumatologist, she outlined a really detailed treatment plan that primarily included Plaquenil, which is hydroxychloroquine, and Prednisone, which is a steroid. I will say, kind of give a spoiler alert, that I did have to have sulfasalazine added to my medication list about 2 weeks ago because I was still having joint pain after having been on Plaquenil for about 3 to 4 months. I will get into that in this video as I talk about the pros and the cons of taking Plaquenil. So first, the pros of Plaquenil. These are the positive things that I really like about the medication and the ways that the medication has been effective. Number 1, Plaquenil has decreased the severity of my joint pain from about a daily average of maybe an 8 to a 3 or a 4. And I was taking the Plaquenil for a few weeks, and my doctor told me that Prednisone was not good for you and that I needed to come off of the Prednisone. And every time I tried, I would still have joint pain. So we quickly kind of figured out that the Plaquenil was not 100% effective against the joint pain that I was experiencing before I started. However, it did help to take the edge off, so to speak, after about 6 weeks of taking the Plaquenil. The Plaquenil has relieved my chronic sore throat. It has stopped my hair loss. and it has dramatically decreased my fatigue that I was experiencing. So I would say that was one of the first things that I noticed, is that I wasn't as tired anymore, and I could do a lot more things without like passing out for a nap after having a day of activities. The other pro about Plaquenil is that it is safe for pregnancy. I did just get married, so it was really important to me and my doctor for me to have a treatment plan that was safe to use up until pregnancy and throughout the pregnancy, should that happen. Now for some of the cons of Plaquenil, or some of the things that I just do not like about the medication. One of them is that Plaquenil can cause nausea or stomach upset. I have been able to mostly prevent this by eating a big meal before taking Plaquenil, but there have been times where I did still have a stomach upset. Those outweigh that particular con. Plaquenil can be really expensive depending on your insurance, or if you have insurance. I know without insurance it is maybe $300, but with my insurance the copay is about $18, and my copays for other medicines are about $5. So there is a little bit of a price difference between Plaquenil and other medicines, and I think that Plaquenil's use for COVID has also driven up the price. Another con is that Plaquenil takes 6 weeks to 6 months to fully work. So my doctor really wanted to emphasize to me that Plaquenil is a medicine that has to build up in your system, and right around 6 weeks you will start to feel the full effects. So it really took a while for me to notice a difference, especially in the joint pain, whereas I noticed it helped with fatigue right away. As far as joint pain and sore throat, it took a little while for the Plaquenil to work, and I would say right around 6 weeks I was just starting to feel the positive effects. So that could be something that could really deter you from wanting to choose Plaquenil. However, my doctor was really good about prescribing Prednisone to help me in the interim while I was waiting for the Plaquenil to take effect. Another con is that Plaquenil usually ends up needing to be supplemented by another medication. In my case, I'm now taking Sulfasalazine as well, which is a medication that is used in rheumatoid arthritis. That is because Plaquenil is known to not be 100% effective when it comes to patients who are presenting with a lot of joint pain. And the last con is that Plaquenil can cause vision problems. My doctor told me that for the first 5 years I will have to get a yearly comprehensive eye exam, and then after that I will need to get an eye exam like every 6 months, I think, which is pretty intense because Plaquenil can cause some vision issues in some people. From what I understand though, it is a very small percentage of people, but that could be a con, especially if you already have vision issues. Overall, my impression of Plaquenil changed from when I first started taking it to and now when I've been taking it for about 3 or 4 months. I think it is a great medication, and I think that now that I have another medication that I am taking with Plaquenil, I am really hitting my stride and I'm really feeling my best because the joint pain is not as severe as it used to be, and I can really feel a difference when I don't take the medication. I would definitely recommend talking to your doctor if you have an autoimmune disease about the use of Plaquenil, and I would encourage you to try it. Just be open to this medication as an option. From what I understand, it's very safe, and I think that the pros really outweigh the cons on this one. Thank you guys so much for watching. I'm so appreciative of all of the comments, the messages, the subscriptions. I have like 3 or 4 last time I checked. Thank you so much for the support. Please comment down below with your experiences with Plaquenil, and please subscribe if you would like to see Christian content and more content about living your best life despite being diagnosed with 2 chronic illnesses. Thank you so much for watching. Don't forget to subscribe, and don't forget to also follow me on Instagram for more.